So let's review the answers on delegation. So number one was the patient had an immobilizer on their right leg. They needed assistance to get out of bed and to use the urinal and then get back in bed. Is that something that can be delegated? Yes, it can be delegated. Number two, your patient above, one with immobilizer, is in pain, complaining of pain in his right foot and says his toes look funny. Is that something you can delegate? An assessment should never be delegated. Number three, female patient, status post hysterectomy. She got a unit of blood right afterwards. She advised the previous nurse that her IV didn't feel right. And now she's telling the next person that the IV doesn't feel right again. Is that something you can delegate? Because that's an assessment. That's an assessment to determine if that IV needs to be pulled and repositioned, replaced. Number four, patient ordered fasting glucose, finger sticks daily. Yes, that can be delegated as long as the unlicensed assistant personnel has been trained and deemed competent. Number five, patient has a wound on her left arm that needs to be covered with a waterproof sleeve so she can take a shower. Is that something that can be delegated? Yes, it can be delegated because it's just a matter of putting on a sleeve over top of the wound. But personally, I would want to assess that before that sleeve goes over it. But the answer is it can be delegated. Patient received results from testing yesterday and learned he has a terminal illness. He's requested to be discharged in order to go home to spend his remaining time with his family. But he wants to know more about his disease and what resources are available to him when he goes home. Can that be delegated? Absolutely not. You need to do some patient teaching. You need to do referrals. Maybe you would do a referral to a social work to see if there's resources in his community that can help him as he continues to live his life. So I hope those rationales helped. And again, see you next video. Bye for now.